Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your host Edward McQueen and April Garner.
Good evening, Sister Joella. How are you?
Oh, I'm fine, Sister April. How are you this evening?
I'm doing fine, and it's another great Monday, and we'd like to welcome everyone to the World Community Magazine. I am April Garner, and we have Sister Joella McQueen with us tonight instead of Brother Edward McQueen, but she's his better half, so we've got the best half of the team on the screen tonight. How about that?
Oh, thank you for being so modest with that. We work together. All three of us work together as a team, and we're just so humbled to be able to let our viewers know that we have such beautiful, beautiful people coming on. And it's a blessing when we can get testimonies in terms of the topic. So I'm just elated, and I thank God for giving us another day to be able to help educate our community and beyond. Thank you, Sister April.
Absolutely. And so we have some wonderful guests with us this evening. And of course, our topic is all about breast health and breast care and the importance of screenings. And all of our guests this evening are actual local survivors of cancer scares. And they are here to share with us some of their stories about their experiences, and also just to give anyone who's listening advice on what they need to do to make sure that their breast health is in check. And so we kind of run the gamut when it comes to generations. And as you will see in just a few moments, we have a wide spectrum of beautiful women, each with a unique story to tell. And we're going to welcome them in just a moment. Just a few housekeeping details. I want to remind everyone that if you want to post any comments or questions, you can do so in the thread, and we will moderate those questions for our guest panelists. Also, if you would just like to know more about any of the information that you hear this evening, make sure you let our guests know so that they can be sure to share that information throughout the community and with you, and we'll be sure to get that information to everyone as well. And I know that the May issue of the World Community Magazine focuses on breast health, and so you'll want to make sure that you refer to that magazine as well to get more information about tonight's topic. So what I'm going to do is bring all of our guests on, and because this is a discussion, and so if we have everyone on the screen, we can kind of bounce off of each other with questions and comments, and as we hear about the story. So joining us tonight, we have, and I think I'm going to start with our Queen Mother, who is on. Yes. And so we have Mrs. Mary Moore. Hi, Miss Moore. How are you?
Fine, sweetie.
All right. Looking like a queen, too. Love that head wrap.
I'm telling you.
Yes. Looks beautiful. Absolutely. Yes. All right. And then also we're going to welcome another queen, Miss Ty Grissom. How are you, Ty?
I'm blessed, my dear. How are you?
Yes, we're fine this evening. Thank you so much for joining us. And Deborah, wave at me if you're ready for me to add you to the stream. I know that you're trying to get situated over there. Just just give me a thumbs up when you're ready, and I'll add you. Are you ready? Okay. All right. And then we also have joining us Deborah Butler. How are you, Deborah?
How you doing, Deborah?
All right. Awesome. So, of course, tonight, ladies, we are talking about breast health and the importance of screenings. And, as we said to our viewers, all of you have a unique story, yet it is within the same, within the same concept of what the show is about tonight. And it's very interesting because as I look at the ladies on the screen who are our special guests tonight, it's kind of hard. I'm gonna go ahead and say this. It's kind of hard to tell ages because Black don't crack. But
that's right.
And for those of you who don't know, if you don't know what that means, just ask someone who has more melanin than you, and then you'll find out. But basically, it's hard to tell the ages of the ladies on this show tonight, and that's important because that means that cancer strikes at any age, and everybody's situation may have been different as far as how they found out about their breast cancer situation, and how they dealt with it. And so these stories are going to be really not only interesting and unique, but they're going to be fantastic and just absolutely glorious, because all of them are survivors, and they're going to tell you how you can survive it too. So let's start with Mother Moore. Mother Moore.
Yes.
First of all, welcome. And
Welcome,
why don't you,
Mother.
yes, let everyone know a little bit about yourself.
A little bit about myself.
Yes, ma'am.
Is that I have an old friend that used to appear on TV called Minnie Pearl. She was a hillbilly of sorts, and she would always say, "I'm so proud to be here." That's the way it is with me tonight. I am so proud to be here because at my age, all my friends are just about gone. And I was thinking to myself, I don't know why the Lord is leaving me here. But I found out just a few short months ago why he was leaving me here. He wanted me to be able to testify to you young ladies in your early 20s.
Thank you.
The importance of checking yourselves for breast cancer. Once upon a time, I was an ardent leader in this fight. We had to go to the homes of our ladies and give out little cards to them to make donations to the Cancer Fund. And somehow we just got slack at doing it. I did. And I stopped with the collecting the funds and with getting the mammograms. I said, oh, I'm just too old to have this cancer thing. I'm not going to be bothered with it anymore. But even today, at my age, I have in the last 2 months found out that I am not too old for this thing. And I am here tonight as a witness to that. And I want you to come to realize, as a result of the brand new information that is before us, that you are not too young and you are not too old. Asking you to jump in the fight now, and let's get the coals all stirred up and ready to do whatever we can to fight this thing. It can be beat, and we are going to have to beat it. Young and old, rich or poor, black or white or brown or whomever you are, if you are a woman.
And that is so true, Mother Moore. And if you don't mind, will you let the audience know just how young you are?
I am 92. Usually 3 months after I'm a certain age, I'll go to the next year just immediately. So I'm really 93 right tonight.
Thank God. Thank God for that.
Yes,
God be
yes.
glory. God be
Yes,
glory.
absolutely. And that's what makes your story even more significant, because it's a late age cancer, just like we're always surprised about early age cancers. And so,
Right.
Yeah, you're absolutely right. Just, get screened at any age.
Yes, you should.
Mm-hmm.
I had confessed to Dr. Adamson, that the last time he gave me my appointment for the mammogram, I said, He said, follow this now. I took it and put it in the trash can. I said, I can't get in that trash can. I'm too big to follow that sheet that he just gave me about a mammogram. So don't think you're too big to get into your trash can. Don't put it in Get with it, ladies. Get with it.
Yes,
Mm-hmm. Yes, ma'am. Yes, ma'am. So following Mother Moore, we have Deborah Butler. Deborah, how are you this evening? Yeah, you might be muted.
I'm muted.
There you go.
Okay.
All right.
There we go.
Yeah. How
I'm
are you
great.
this evening?
I'm good.
Okay.
A little uncomfortable, but we're working on it.
Working on that. Okay. Yeah. So,
We'll pray for
just
you, Sister Deborah.
I appreciate it. I need it.
mhm. So why don't you let our viewers know a little bit about yourself as well?
Let's see. I am a retired registered nurse. Got diagnosed with breast cancer probably 2005. It's been 16 years of a most marvelous journey. And I say that because I have met some wonderful people along the way. And I think, as Mother Moore said, the importance of screening cannot be overemphasized. The importance of getting your mammograms. And when people tell me they're too old or they don't have to worry about it, my first question is, are you still living? And is your tissue alive and viable? Because as long as you have tissue that is alive and viable, you can have cancer. So, on when you're talking about the discovery portion, we really emphasize, especially in the medical community, the importance of getting those mammograms, getting them on time, and following up. You know, a very good friend of mine had a lump found on the mammogram and decided it wasn't important for her to follow up, because she's like, I really don't want to know the answer. So when they did the referral, she threw it away. Well, a year later, what could have been just a mere biopsy and just removal of that tissue, she ended up losing the breast. And those things don't have to happen because we fear what's going to happen. Cancer treatment is so very different than it was years ago. And I
Yes.
always like to say it is not a death sentence. It is, I always call it my test of faith. And it was, did I warm the pew or did I believe what I was hearing? And so, and believe me, it is truly a test of faith. But you know, through God's grace and mercy, I'm still here to help other women.
Yeah.
Thank God.
Absolutely. And last but not least, we have Miss Ty Grissett. How are you, Ty?
Good to see you.
I am wonderfully blessed. Thank you so very much for having me on today. Very excited to be in the midst of these beautiful women. Just to, I guess, tell you a little bit my story. I diagnosed approximately, I'm looking at the calendar now, about almost 2 years. And when I think about it, my cancer was diagnosed with a mammogram, illustrating the very importance of making sure that you get your annual mammograms. I was diagnosed at age 44. I'm 46 now. And my doctors considered me to be a young breast cancer patient. When I was going into my treatments, I literally looked around and was like, very much, I'm the youngest one in here. But I'm a testament of the faith of the power of a mammogram. Again, my breast cancer, there were no lumps that could be felt. It could only be seen on a mammogram. And when looking at my mammogram, my doctor, Dr. Brackett, said that he said, my goodness, he said, this is a nasty little joker, but we're going to take care of it. And I'm just so thankful today to be able to be here and say that thank you, God, for allowing me to live. It is a test of faith. That you, when you're going through, I had chemo, radiation, and I've had 3 surgeries. And it truly, you're like, wow, okay, God. I was already an advocate. You know, I'd have to necessarily become a card carrying member of the Breast Cancer Club, but God saw fit for me to become a card carrying member and not just be a. And now I can truly say, I close my eyes for good. It will be. I will truly encourage other women to get their mammograms.
Absolutely. Well, and again, all 3 of your stories are very compelling as far as you know, when you were affected and the impact that dealing with breast cancer has had on your lives. But, you know, as you think back over your experience, can either of you, one of you, all of you, share with us the first thing you thought about whenever you were told that you had that diagnosis? What was the very first thing that you thought of?
This is not happening. Like, this is
I was
not
like, I can't believe this.
like,
I
right.
can't believe
It's
this.
like,
That's when my first
I got
thought.
what? I was like, no, I don't have that. I got what? No. So, it was the furthest thing from my
I was like,
mind.
I'm too young.
Well, I
Yeah.
never.
But
I think I thought I was had done all the right things. You know, I tried to eat right. I tried to do the things that were, you know, preventative, and to be told, and first off, we had a lot of changes on pathology reports and saying, oh, you're going to be fine, you don't need to follow up, you do it in 6 months. And it was my persistence that, no, you know, I really don't want to have to follow up, let's just remove them. And so, against the physician's advice, I was like, look, I don't, you know, I'm just not the kind of person that's going to remember to do this every 3 months. And then it was found then that it had already spread. So when one of the things that I think I have stressed when we're doing our in-services, our educational sessions, is to thy own self be true. Know your body and know when something is different. You know, my lump, unlike Ty, you could feel it, but I didn't think it was anything. Now, that because I was very lumpy anyway, but this lump was very different, and it felt different, and it grew faster. And so that's when I think, you know, deep down that something's wrong, but in the back of my mind, breast cancer was the furthest thing from my mind.
Well, I had this little feeling of it's like two fingers right up here. It was above. I said, Gerald, come here. And so she came. Mommy, that thing is hard. I said, it is. So went on for a few days. It looked like it just went south. I said, it's gone. And I kept feeling around. So finally came back. And I did that for maybe about a couple of weeks. And I said, I guess we better do something about this. So she told James, and he said, you and your mama get on over there and get your mammogram. What? Mammogram? I don't want that thing. I don't want to do that. I was just didn't want to go through that. But yet, I didn't have a feeling of fear that I had cancer or may have had cancer. I just said, okay, I'll go. We went and we got the mammogram and the ultrasound. I went through the works, and the doctor said, "Oh, you're a good patient." I said, "What you mean I'm a good patient?" He said, "Well, you didn't curse me and you didn't kick me." And with that, I thought, I must be a pretty tough cookie. So I think I'll go through with this. And came back, and Carol and I talked about it. So we went on, didn't stop until we got to the doctor. He walked in the room, he saw the two of us. He said, he looked like, he said, now, which one of you is the 92-year-old? He looked at Cheryl, looked at me again. Cheryl said, she is. He said, you the 92-year-old? Let me see your license. Well, I went in my pocketbook and got my license, so I said, 92. But everything was just as smooth. I didn't have any fear about what was or wasn't going to happen. Well, he said, you know, your liver is good, your kidney is good, everything, the heart. You better look for something else to die from in the next 10 years. You know, that just gave me all the confidence I needed, along with that faith that I already had in God.
That's right.
I went through everything just as smooth as any little baby's honey. He has given me to go ahead then at that particular time to let's just get this thing one out of the way. I didn't have any fear. Oh, I want cosmetic this, a cosmetic that, a longevity that. Those words didn't even pop up in my mind. Had the surgery look like in about 30, 40 minutes. Out, going home. No, gave me pain pills. Didn't take a pain pill. Gave me nausea pill. Didn't take a nausea pill. Sit your little self down. I just met you, but I know you're spunky. Sit yourself down. Have I sat down yet? No. Going straight ever since. Trusting in the Lord and doing what the doctor has directed me to do.
Yes, ma'am. Yes, ma'am. So
That's a blessing. That is true.
yes, as all of you have spoken about the mammogram piece, and I don't know if it's taboo among Black women or what the I guess the perception is of mammograms. I know I used to hear, you know, women in my family and in my mom circles talk about how painful it was, and they didn't, you know, want to go through the process, and I think that that's a part of why we tend to miss out on the preventative pieces, and because you know we've been jaded when it comes down to that breast cancer, or that just the breast screening in general, not just the breast cancer piece, but the screening in general. So Deborah, I know that you and Ty have both worked in the medical field per se, and what do you think? Has that changed as far as the perception among our culture? And, do you find that more Black women are having breast cancer screenings now? They are getting their mammograms, and hopefully it's across generations when especially when you were first able to get a mammogram. And has anything changed?
I think
you take it or you want me to do it?
Yeah, go ahead. Go ahead.
You got it.
Yeah, well, you both can chime in.
I was just going to address. I know, right? I was going to address first off the reasons why people state that they do not receive mammograms. There is that one reason that it hurts. I hear people say that, but I would think the most important reason that I hear a lot of people say is they don't think they need it. They're like, I'm good, I'm fine. I don't really think I need it. The other reason I hear too is that I can't afford it. Miss Ty, I can't afford that mammogram. And it's not convenient time for me to be able to go for my mammogram. And then I'll even throw in there the other caveat that I hear often, which is the if I got it, I don't even want to know. You have a lot of people that will tell you that they have cancer. They don't want to know about it. So they just rather go on out with whatever that is they came into the world with. And, we have to really fight those things in order to truly try to bring about awareness. And then, Deborah, you can take it from there.
And one of the other things when you talk about a lot of women have said, well, I don't have a family history. I didn't have a family history either. And so when you start looking at the full picture of economics and can I afford it, there are programs that assist women in getting mammograms. There are mammogram services that are open a little later for those women who work. It's very difficult sometimes, especially if your family, if there was no cancer history. And I remember my doctor used to always say to me, I was a genetic mutant. And I would say, every time I come here, I get a new name. It's either I'm the genetic mutant or I'm this or that. But in all of that, when we're doing our workshops, and I think of the number of women that even got identified when we were doing some of the other teaching with the Witness Project. It was, I felt this, I don't want to go, and I don't want to know the outcome. And then I would love it when people say, oh, you don't look like you had cancer. Well, what do you look like when you had it? if you saw me going through, yeah, I looked like I had it. But once you get on the other side, the testimony and to get women to pursue and get your mammogram is that they see you're fine or you're doing better now. And to me, that was one of the most critical things. And also helping women maneuver to find those services that they could get if they don't have any money. And there are programs out there, Best Chance Network. And so, our goal, and I know particularly with Ty, is I feel like we were joined at the hip at one point because, we were both nurses. And I think when I found out she had breast cancer, I was like, what is this? Wait a minute. We didn't need to be the card carrying members, but I think that has that has that has its advantages when we're speaking to women and encouraging them to get their mammograms and follow up. And that's one of the hardest things is, it's easy to say, well, if they find something, I don't want to know. But in essence, you really do want to know.
I can imagine that, the sooner your survival rate goes up. It definitely and I know that is a part of the fear factor as well. Absolutely. Because as with anything else, we don't want to know, even if it isn't as grave as a possible breast cancer or any other cancer scare. But yeah, we have to just kind of pull it together and do what we have to do if we want to increase our chances of survival. So there's a couple of things that have come through onto the thread tonight, and I definitely want to pull them up, comments from our viewers. And again, thank you so much. If you're watching this right now, please share the post if you're on Facebook. Also, you can copy the YouTube link and send it as a text message or in an email to someone who you believe needs to hear the messages from these beautiful breast cancer survivors tonight. And especially if you are a Black woman, I think it's important to hear these messages so that, hopefully it will release some of the fears that some may have about getting the screenings and what they need to do. So, Glennis McCrae, thank you. Yes, ma'am.
April? Yes, ma'am. I just want to interject. This is the reason why the World Community Magazine is really reaching out to Black doctors across the nation, because we want everyone to know that there's always something or some information that you can get. And the doctor that we are working with from Washington, D.C. is a very humble person who had the goal to go into one of the poorest areas of Washington, D.C., to work with those Black women and Latino women who would not normally have a chance to get a regular mammogram. And it's the same message that Sister Deborah and Sister Ty and Mother Moore are saying, that people fear going in and getting that annual mammogram. And it's very, very important. And that's why we're going to work with all doctors in terms of letting us get the message out. So Dr. Regina Hampton will be writing another column for us to talk about what you have just said about the fear of going and getting that mammogram and then getting it annually, because that is the only way that we're going to be able to beat cancer in our Black community and people of color in the community. So thank you so much for bringing that in. And so April, you can go back to, the questions in the thread.
That I met so many.
Okay, thank you. So Glennis McCrae writes, thank you all for sharing your time and wisdom to present this information. Can you all speak to the history of breast cancer in your family? And Deborah kind of touched on that, but do you want to share, Ty or Ms. Mother Moore, about the history in your family?
Well, that was one of the shocking things that the doctor said. Is there any history in breast cancer? Oh, no, doctor. Do you not know that I have a cousin that's 98 years old and has of this year, 2009, since 2009. Nobody ever knew. I have another relative who has had 7 surgeries for the lump. Nobody in my family about that. I mean, what is the big secret? What is the fear? We've just got to overcome that. And we've got to be the ambassadors for putting the word out there so that these people can do what is best for their own health and for the health of other women.
I think sometimes
I will say, like Mother Moore was saying, the more we talk to our families, we had a family reunion, which we hadn't had one in probably 10 or 15 years. Well, the cousins that were around my age, at least 2 of us, had breast cancer. Then we started talking, and it was more other types of cancer than breast, or it was maybe a second or third cousin. So, but I found that as especially in our community, we tend not to talk about breast cancer or cervical cancer or whatever. It's like it's this deep, dark secret. And God forbid we tell somebody, because it may mean that, girl, we got something. We done committed a mortal sin. And so once you lose those fears and don't have the fear of talking about it, because I think I have been working with breast cancer and prostate cancer ever since I probably finished nursing school, and it had become my passion. But I'm like, Ty, I didn't think I needed to be a card carrying member to get the point across. But the difference that it has made is my story probably has helped someone either get a mammogram, follow up, or do something that they would not have done because they see you as a survivor and not as a statistic. So those are things, it has probably become my passion more so than I thought it would, because I see what happens when women don't follow up or they choose another path and say, well, I don't want that, even though they may recommend that you have the removal of the breast. It has always amazed me, like my great grandmother used to say, she came with 2 legs, she was going to leave here with 2, but she left with 1.5. But and it's the same thing that how society views your breast, and it also forces some women to make other decisions because they fear that there will be no more intimacy, or their life is going to change significantly because the breast is not there. And I just remind them, it's just tissue, y'all. They can put some new ones where you don't want them. You don't have to get some new ones.
Well, we're going to take a little short break, and when we come back, go ahead, Ty. Go ahead. Yeah, there's a little bit of delay coming from you, so that's fine.
I just wanted to answer a question. I'm sorry. I just wanted to answer a question really about family history. And looking at my own family history, it's very much like what Mother Moore and Deborah were both talking about. We didn't talk about it enough. You just didn't talk about cancer at all, much less breast cancer. And when I did do some investigating, there were like 3 members in our family that had been diagnosed with breast cancer and had passed. But it wasn't until we went to the family reunion. Deborah is right. You started talking at the family reunion, and I saw other members of the other side of the family I don't see very often. I found out that there was lots of breast cancer over on that side, and that many people on that side, it was much more common on that side of the family, and that people had died from breast cancer, and it was just not talked about on our side of the family, And so for me, it was reassuring because it was like, oh, it's not a anomaly. The history here, everybody's got to break the cycle, and that's gonna be me. The other, I see there's another question. If I can just say it real fast about a mammogram, a 3D mammogram.
Yeah, I want to get to that when we come back.
And the importance of getting a 3D mammogram.
Yeah, I want to get to that when we come back from commercial.
Okay. All right, because I got about that.
No, I know you do. I know you do, but I want to give everybody
about that one.
That's all right. Yeah, I'm gonna let you get to it. I'm gonna let you be the first, but I want to take a small break. But one thing I do want to say as we roll to the break, as we're coming out of COVID and people are getting vaccinations or whatever they're choosing to do, and they're starting these family reunions again. I think along with past the potato salad, there needs to be, please pass me that medical history form.
That's right.
Yeah.
Okay, so we need to bring back the idea of family reunions, and while we're there, make it productive and get our history while we have our families together. So remember, pass the potato and the medical history form. Okay,
That's right.
all right. So we're gonna take Mother Moore. So I'm gonna take a short break, and then we'll be right back. And Ty's gonna kick off.
I'll drink to that.
Answer that question, okay?
Okay.
All right. We'll be right back.
If you want to support Black-owned and operated businesses in the Grand Strand area and beyond, check out thenetworkconnects.com for a complete list of establishments in our local area. Our network connects Black businesses to community for a wide range of services, products, organizations, and resources that are viable in the African American community. You'll find a wide range of products and services that'll fit your needs, along with information about events and happenings around the local communities. Check out thenetworkconnects.com, connecting Black businesses to community. Thenetworkconnects.com.
we are back. Sister Joella, we're having a good time so far.
We are. Information is power, okay? And this is so beautiful with our beautiful family, okay? It's just wonderful, wonderful.
Absolutely. Do you have any special announcements before we bring our guests back on?
Yes, ma'am, I do, Sister April. This is from Miss Priscilla Fuller, who is a graduate of the class of 1971 from Conway High School. And she just wants us to announce that they will be commemorating the 50th high school class reunion on May the 22nd, which is coming up this Saturday. And they are going to be, the reunion event will take place from 1 to 4 p.m. in the Conway Sports and Fitness Center on Mill Pond Road in Conway in the Kingston and Rivertown meeting rooms. A donation per person of $20. But I'm understanding from this that it has already been booked, and they are going to have more people coming in than I guess they had anticipated. And she said that the 1971 yearbook staff decided to use the two colors that were not chosen, purple and orange, to say farewell to them, but also because they fit the theme of peace and love generation of that era. So everyone, please look forward to attending. And I understand that on May the 14th, Mayor Blaine Bellamy will give an official proclamation claiming May 22nd as Conway High School class of 1971 Day. So please attend, and this is coming from Ms. Priscilla Fuller. And I pray that they have a beautiful, beautiful, and memorable class reunion, 50th class reunion. Okay?
Yeah, that is absolutely awesome. And thank you so much, Priscilla Fuller, for sharing that wonderful information with us. And yeah, that they're going to have a good time, I'm sure. And Priscilla, our loyal viewers, and she watches the show every week and is very engaged in the conversations. And so I'm going to share a comment from her as well about the broadcast before we actually end the show. I have a couple of other messages for our guests as well, and then I'll bring them back on. Marjorie McIver says, thank you, beautiful women, for sharing these personal testimonies. So thank you, Ms. McIver, for tuning in this evening. And also Tanya Malden, who's a good friend of mine out of Greenville, South Carolina. She says, thank you, ladies, for sharing your stories. And thank you, Tanya, for watching as well. Please pass on the information because we definitely could save some lives and remove the stigma of breast cancer screenings. And that's, I think, a part of the purpose for this evening. So I'm going to bring everyone back on the screen. Looks like everybody's kind of had a moment to adjust and get ready for the second part. So along with those comments came a comment from Monique Carver. She says, as a breast cancer survivor and a previous clinical researcher, please emphasize that women request 3D mammogram. So I know Ty was getting ready to kick us off with some information about 3D mammogram. So Ty, can you share with us what you know?
Yes, and thank you, Monique. And shouts out to you for being a breast cancer survivor. You're a card carrying member too. Thank you again for that question. Regarding the 3D mammogram, 3D mammograms are still fairly new to this area. They may not be new per se across the United States still, but in this area, they're still pretty new. And across the state, it's still pretty new. I know that there are some facilities that do have 3D mammography machines, including Conway Medical, which is where my first was diagnosed at, and I still has one as well. But here's the thing about 3D mammograms. Sometimes insurance doesn't want to pay for them. And so when my insurance company did not want to pay for a 3D mammogram for me, this was before for my annual mammogram. So I ended up initially having a traditional 2D mammogram. So I always tell people at the end of the day, get a mammogram. I can, advocate for a mammogram later on down the line, but baby, just get your tail in there and get a mammogram first. Let's just get them in and get a mammogram. And because the second part of that is that I hate for someone to receive a bill for a mammogram that they can't afford to pay. because the hospitals will pass that cost on to the person if their insurance does not want to cover it. Because the choice to me, do you want to pay out of pocket for the difference? And I was like, no, ma'am, I don't. Just give me a traditional mammogram, and we can go from there. Most cancers are found on traditional mammograms. Do provide a better picture, the radiographer and the doctor to be able to look at the tissue, able to distinguish between, if it's a lymph node or if it's a clogged milk duct. It does provide a better picture for that. So unfortunately, though, insurance companies don't care.
Deborah, you're muted if you want to add to that.
I was in full agreement with Ty. Just the things that the insurance company is willing to pay for, and what you may end up having to pay the difference. And that goes all throughout when on some of the treatments. But you have to be your own advocate, even with Blue Cross Blue Shield or whoever it is. If you can't advocate for yourself, sometimes it can pose some problems. But most of us, you're so distraught when that happens that you don't want to think about, well, I got to fight with them for a 3D mammogram. And I'm like, Ty, just get a mammogram and we can start from there, but 3D is awesome, but just a plain old one that's been working for years is awesome too.
All right.
Yeah.
One question I would like to ask is about the cost of the actual operation of the procedure. Would affordable healthcare insurance take care of that, or you have to go through your own private insurance, or just what usually takes place with that?
I didn't understand your question.
Are you saying for surgery?
Surgery, right?
Right, the surgery
or the treatment.
Treatment, any cost that is attached to everything that you go through. The actual, I know the mammogram, but then after finding that, will your insurance kick in to pay for the actual operation and the recovery and everything like that? If a person doesn't have insurance,
it truly depends on your type of insurance that you have.
Okay.
It truly depends on the type of insurance that you have. Some plans are designed to be able to kick into those costs, but let's say like some catastrophic plans, for instance, those will kick in. But if you have a plan that doesn't cover cancer treatments, and there are some insurance plans that don't cover that, then those will be costs that you will incur and that you will have to pay for yourself. And it's unfortunate, but many times people that go through cancer treatment have to decide between their treatment or their bills, and that's when, honestly, that's when you need to call me and Deborah, because we'll try. I know a lot of people, a lot of programs, and between the two of us, we can make sure that you be able to get some assistance in making sure that your breast cancer treatment is affordable for you. But yes, ma'am, I know, for instance, with my first surgery involved 2 surgeries, and I believe the cost came out to right around $35,000. And that was just 1 surgery. Just to let you know, another cost, my chemotherapy treatments, which I received every 3 weeks, the medicine by itself was $15,000. Little bag of medicine cost $15,000. And that did not include the administration, the cost of sitting in that chair, the cost of the nurse. None of that was included in that. But I thank God that I had insurance to cover that. But think about for the people that don't have insurance. That's they just like, I just don't want to know.
Yeah, and there is a lot of programs that cover to pick up the difference, whether it's reconstructive surgery. When you start adding up the cost, it wasn't just the chemo, it's the injections you have to have to keep your blood count up. It's many things, but there are so many programs, and that's when I said contact me and Ty, because it's just like you meet people and you find out about different programs. There are things that are changing for coverage of different procedures. It's a lot that can be done, but I still go back. In order to get all that started, you got to get the basics. It's like, let's start with your mammogram.
Right. Yes.
Mhm.
Thank
And
you
I
very
will
much.
add this, and I want to add this one extra piece as well too. When I was diagnosed, I had two insurance plans. I had two very good insurance plans to be able to draw from to help with my treatment. I tell you what, either one of them wanted to pay $1,000 of costs associated with the plan because me insurance company wanted to pay. They kept pointing the other one for them to pay, and so what ended up happening was neither one of them paid. So I had to fight those companies as well to get them to start paying for my treatments.
Okay.
And
Mother
with,
Moore, you. Oh, I'm sorry.
I was
Go
going
ahead,
to say
Deborah.
with the and I too had two insurance companies, and sometimes it was like, who's going to pay? Luckily, they were both Blue Cross. It was just one in one state, one in another, and then you got to just merge the plans and find out who's going to do what. But as people go through and find out, like I said, it's a journey, and there's bumps and hills, and there's stops, and go and let's slow down and hit the curve here. But I keep saying I cannot stress the importance of mammograms and also following through. You can get a mammogram, but if you go, oh Lord, they're gonna tell me it's cancer, when it could not be that. You have to follow through even after you have the mammogram. And most of us, we take care of everyone else, but we don't want to take care of ourselves. And that's one of the biggest things that I think we have stressed over, I know, the last 16, 17 years, is the importance of following through, get your mammograms, and knowledge of your own body. Those are critical things that if you take nothing away from this session, is follow through with the mammograms, and follow through is the one of the most important things that I could stress upon someone.
Awesome.
Well said. Thank you very much.
Yeah. Mother Moore, go ahead.
I'm the rookie on that part, the paying part, but I'm glad to meet you. Glad to meet you. But anyway, I've had for years in cancer insurance policies. I have two. Cheryl hadn't gotten into that yet, but just as soon as I get the bills, I'll just send them on to her.
There you go.
She'll need to see about that. But hang on to those policies, if you until you find something else better. Now here I am at this age, and I've still clung to my cancer policies. Nobody could have told me that I would need those policies, but now I do. Give up some of your $450 hairdos and put that money aside so that if you need it for your cancer, your mammograms or whatever, you will have that there, because that means more than looking pretty when you are dying daily from something that you don't have to die from.
Yes, ma'am.
Take it from old granny. And I'm not
serious.
Words of wisdom
in your business. But those are just facts, ladies.
Mother Moore is very serious about what she's looking at her face. Very serious about what
she's always been that way. And she's always been that way as our beautiful guidance counselor. And we just love her, and we pray that everything continues to do well with all of our beautiful.
That's right.
Yes, absolutely. So I want to share some more comments from the thread as we come almost to a close of this wonderful broadcast. Again, Priscilla Fuller, she says all of these beautiful ladies will appear to have positive attitudes regarding their experiences. Do they feel that this was essential to their treatment? Thank you, ladies, for sharing. Priscilla Wyman Fuller. So the positive attitude, I think all of you have kind of touched on it, but absolutely. I'm sure being positive definitely keeps you from stressing and
it makes a huge difference. Positive attitude and positive people around you. Because you don't want somebody got like, girl, so-and-so died from that. And my aunt died 10 times over. You want it, because there are going to be days, I don't care how strong you are, that you're going to feel, especially going through chemo, that it's no way that I could make it through this. So you need that positive, and for and I know what was common, I know amongst the three of us, was our faith. That I used to always say, devil, you picked the wrong body, God's got this, so you hang on over there because he's gonna bring me through. And with that kind of attitude, that is what gets you through. You have to be so positive, because cancer impacts the entire family. It's not just you, it's everybody around you that's in your close circle. And for some of us, even those that were on the outskirts, it impacts, because you're going to need them. Sometimes you just needed somebody to talk to that understood what you're going through. And you just have to stay so positive, because that, and I always say God's grace and mercy is going to get you through, because you just have to remember that he's got it. You just holding on to his unchanging hand. And like things that my grandmother and my great grandmother used to tell me, I clearly understand now. That, they say you'll understand things by and by. Oh, I know what that means now. I didn't used to know what that meant, but I do now. So that's a critical part of treatment, the thing that they may never mention, but that is just solid. It just makes all the difference in the world.
There's a response to the mammogram discussion that we had, another response from Monique Carver. Yes, all of your responses are very true. However, they're especially important for women with dense breasts whose tumors don't present on traditional digital mammography. And I know that I'm one of those women who, was always concerned about whether or not the regular mammograms would pick up everything, because I am dense and bodacious. And so I've had the 3D mammogram and felt much better about the 3D imaging, and and it was actually more comfortable than I thought it would be. So, that was one comment that she had about your discussion about the mammograms as well. And then Glennis McCrae mentioned that another resource for post-surgical medications, oftentimes pharmaceutical companies have compassionate care policies that will pick up the cost of high-priced drugs. So there are resources out there. Mother Moore mentioned the cancer policy.
This is my niece. She lives in California.
Oh, Faith, yes, ma'am. She said, yes, Aunt Mary, so true. So Faith Epps, thanks so much for listening all the way from California. That is awesome. That's family support. That's love.
That's right.
And yes, and so there are resources and things that you viewers who may have some concerns can actually research and look into. And I'm sure that if you want to reach back to anyone who is a special guest on the show tonight, they'll be able to point you in the right direction of some information and resources that you need. And as we come to a close this evening, what I want each of you to do is to give, just one solid word of advice about living beyond the breast cancer scare. Since you all are survivors, I'm sure your outlook on life is even different now that you've had this experience. How has your point of view about life changed, and what would you advise people to do if they feel like they might be facing a crisis situation that they're fearful of? So I'm going to start with Ty, and I'm have Mother Moore to give the last word. So Ty. You might be frozen. Oh, there she is.
Thank you for giving me the first. I was ready to hear what the rest of them had to say. I would say, did my opinion change? You bet. Life is precious now. I don't have time for people that ain't got time for me. And I don't have time for people that's not trying to do something positive with their life. You can either get on my train or get out my way, because I'm coming full steam ahead. And now I'm at the point in my life where I just trying to live best life full as I can, and trying to make sure that I please God in the process. So life is so precious to me now, whereas I think I took a lot of things for granted before. Now, man, what folks used to say, God, I thank you for waking me up in my mind, for letting me start another day with the blood running warm in my veins. I used to child that and used to be like, Lord, what in the world? Girl, now I'm like, praise God, hallelujah. Yes, God, I thank you for allowing me to wake up to another
That's right.
with the blood running warm in my vein. You don't take a day for granted after you've laid there doing chemo and after you've laid up there doing radiation treatments, after you've had 3 surgeries to remove cancer out of your body. You don't take another day for granted after that.
That's right.
Deborah?
Oh, I agree wholeheartedly with Ty. Life is so precious. It made me appreciate every day, even the cloudy days, because there's something wonderful in that day that as I say, I'm still here to complain. And it's just, I wouldn't say,
That's
like
right.
I always say, I understand more things that my grandmother and my great grandmother said, but and my great grandmother lived to be 100 and was extremely wise. But I just agree with everything Ty said, because it, just move out my way, because my train gonna keep going. Don't slow me down. But every day, it's something. It just you look at things totally different. And you don't take things for granted.
And last but certainly not least, Queen Mother Moore.
Look at it.
World Community Magazine. I want to thank you so much for this article that you have shared with our local community. And if I can piggyback on it, I'm going to make some copies and see that all the ladies in my family and around get copies of this. And believe me, this should serve as a stepping stone for the care that you will be taking with and for yourself following this meeting. And I just want to remind you that all medicine is from God. We get medicine by
That's
the mouth.
right, Mother. That's Mother.
By the mouth. You get it by injection. You may have to get it by surgery. Certainly by prayer, by faith, and affirmation. He puts the icing on the cake. My Lord and my Savior, Jesus Christ. Thank you, ladies. Thank you.
Amen.
Well, thank you all. Yes, this has certainly been a wonderful segment, and we can't thank you all enough for sharing your very personal stories with us, and your transparency is to be honored. And we just want to wish all of you continued health, good health, and speedy recoveries if you're going through anything right now. But more importantly, we certainly hope that God blesses your voices to uplift and inspire others to do what they need to do, as Mother Moore said, to just take care of their bodies and to check on things that don't seem right, and just to make sure that you get the proper care, and to share your experiences and your knowledge with your family so that you can stop the cycle of deadly diseases and things that we have to deal with simply because we lack the knowledge. We just don't know what's going on. So my final word of the night is, at the family reunion,
That's
as you
it.
pass the potato salad, pass the medical history form around.
Right.
I sound like my Aunt D. Henry when I say that. Pass the medical history forms around.
That's right.
And get that information. Have someone in your family collect and collate that information and get it out to your family, so that you all will know your history and you'll be able to share that when you go through things. And but Sister Joella, is there anything you'd like to say before we
I just want to say I just love you, and I pray that we all can continue to work together. And I see Sister Ty wants to say something else, but anytime you need to use this platform to come on to share this information with our community and beyond, Sister April and I would just love to have you. And there's my beautiful little sister there, Sister Reverend Cheryl Adamson. How you doing today, sweet? Good. Thank you all so much. To God be the glory, as Mother Moore said. And
thank you for having us.
Last word. Go ahead, my beloved.
Thank you to you girlfriends.
Thank you so much.
Thank you, Mother Moore. We appreciate it.
I just want to let everybody know that I just want to let everybody know that I have a grant to teach breast education information and awareness information. It's called pinkwitness.com. Please go on that website to learn how you can be an advocate for breast cancer awareness. It is for Horry, Georgetown, Williamsburg, and Marion counties. Thank you.
What's the name of it again, Kai? What's the name of it?
Pinkwitness.com.
Pink Witness?
Pink Witness Project.
Pinkwitnessproject.com.
Yes, ma'am. P-I-N-K Witness T-N-E-S. Pink
Witness Project.
Thank you.
Yes. Okay. Pink Witness Project. The Pink Witness Project or Pink Witness Project?
It's Pink Witness, no project.
Pink Witness.
Okay. All right. Well, let me edit that. Yeah, it's kind of buffering in and out.
Pinkwitness.com.
There we go.
No project.
There we go. Pink Witness. Okay. So yeah, make sure you all take note of that. Yes.
Thank you. Thank you.
All right.
Okay.
Yes. So thank you all this evening. Take care. And thank you.
Thank you.
God bless.
All right.
God bless you all.